Welcome, friends and family of the University of Iowa. My name is Megan Reif. I'm the Associate Director of Development at the UI Center for Advancement, and I work within our health sciences team and specifically have the honor of working with our panelists today and donors like our moderator. So we will begin the show very soon. If you would like to turn on closed captioning, you may do so by clicking more on the bottom of your screen and select Show Subtitles. We will have a Q&A towards the end, so you can submit your questions with the Q&A button. We are being recorded today and will be posted to our YouTube channel in just a few weeks if you'd like to share out today's show. So now I have the honor of introducing our moderator, Michelle Bates. She is the founder and CEO of Sky Prairie Incorporated. She is a philanthropist and transformational business and technology executive with more than 25 years of experience across multiple industries and market segments, most right here within our corridor. She and her partner Ann annually support the Tippy College of Business, and were the first donors to give and create the UI Healthcare LGBTQ Clinic Support Fund. Michelle is on the board of Technology Associates of Iowa, impacting her industry, and by that, the LGBTQ population of Iowa. She is also a board member of One Iowa, whose mission is to advance, empower, and improve the lives of LGBTQ Iowans statewide. Michelle, thank you so much for moderating our show today.
Oh, thank you so much, Meg, for having me. And I'm so appreciative of the opportunity to, get to share the story and the great work that, the doctors and the staff members and stuff at UI Healthcare and the LGBTQ Clinic do today, every day, to serve our communities. So I'd like to take the opportunity to introduce our esteemed panelists who are going to be joining me here today. So Dr. Katherine Imborek, Dr. Nicole Nisly, and Dr. Amy Perlman are going to join us today to talk about the inception of the LGBTQ clinic at the University of Iowa Hospitals and Clinics. How it was first in the state really to bring and offer, this caliber of care for the lesbian, gay, transgender, queer, and questioning population. And again, we're so fortunate to have this capability and care in our state. Today, it's only one of a few comprehensive multidisciplinary clinics in the country. The clinic was named a healthcare equality leader by the Human Rights Campaign Foundation. And the clinic provides a safe environment for patients in need of everything from routine health screenings to hormone therapy to gender-affirming surgery. So again, please welcome our panelists here today. So, as we kind of open the dialogue and discussion, it's nice to see, faces as everybody's kind of turning on video. So Amy and Katie and Nicole, it's great to see all of you. I think I'd like to start first with, where are you from and how did you end up at the University of Iowa? So Amy, do you want to start?
Absolutely. Well, good afternoon, party people, and thank you for having me here today. So my name is Amy Perlman. I'm a urologist, and I'm a urologic genitourinary specialist. At no point in my training did I learn how to take care of our transgender patient population. I learned how to do that once I started at the University of Iowa. And I will just start by saying, if I were to die tomorrow, I would feel like my life has had some meaning because I've had this ability to work with this patient population. So I didn't grow up in Iowa. I grew up in the big state of Maryland on the East Coast. I had an opportunity to train all over the country. And with that, I can say that this clinic is a true gem. Being new to Iowa, I never thought that something like this could exist, period. And certainly have been pleasantly surprised that it exists in Iowa. And I can say that just having been at other institutions, this is a worldwide class act. Thank you.
Great, thank you. I mean, we're really glad that you decided to transplant yourself to the great state. So thank you for being here. Nicole, you want to tell us a little bit about you and about your journey and what brought you to U of I?
Of course. So I came to the University of Iowa to train to complete my residency program. I was planning to spend about 3 years here, completing my internal medicine residency. That was 30 years ago. And I came here from Brazil, and I just fell in love with the place, with the opportunities, with Iowa City, with the Iowans in the community. How I came to the clinic, again, my journey at the University of Iowa has been of 30 years, and I've been so blessed to be in such a wonderful place that allows for creativity. And basically, if you can imagine, you can make something happen. So about 10 years ago, I was working actually for the president as a diversity officer. And I had the opportunity to listen to a panel of transgender students talking about their experience in healthcare. And honestly, I was heartbroken and I was ashamed, and I just felt like, we need to do something about that. And as fate would have it, Dr. Imborek was there too, listening to the same panel. And we got together over coffee and we decided, let's make this happen. Let's change this. And that was the beginning. And we, of course, did not do it alone. It's been a journey of many people that, like Dr. Pearlman, like myself, never imagined ourselves doing this. But we fell in love with the community and with the brave, amazing people. They're going through their journey of transition or their journey of coming out in their identities, of telling people about who they are. And we just felt that this is an incredible honor to be able to participate in this journey.
Oh, that's terrific. I mean, when you think about the patients that you work with and stuff every day, I can only imagine, the inspirational stories that you hear from individuals as you impact their lives every day. That's terrific. So, Katie, what about you? What brought you to Iowa?
Thanks, Michelle. It's great to see you, and so nice to be here with Amy and with Nicole. And thanks to everyone out there at home who's joined us. So I came to Iowa City about 20 years ago for graduate school. Actually, I was enrolled in the physical therapy program at the University of Iowa, which was amazing and fun, and I really loved it for the one semester that I did it. But as I was here and sort of met some folks from the Iowa City area, it just so happened that those people were medical residents, and for the first time, I sort of thought, maybe I want to go to medical school, and so was able to matriculate into med school and stayed here then for my residency training in family medicine and joined faculty thereafter. And as Nicole mentioned, it was actually right when I was finishing up my residency, before I was even faculty, that I went to that fateful meeting where there was that panel of trans-identified people talking about their experience in healthcare, and where sort of the impetus for the clinic started. And like Nicole mentioned, it's been almost 10 years, and I almost have to pinch myself sometimes to think about the fact that when I was leaving undergrad and coming to Iowa City, I was in a place and in a mindset where I thought that my own identity as someone who was in the queer community would hold me back from doing things that I ultimately wanted to. And now I'm in the place where the only patients that I see and that I'm lucky enough to see are patients that identify as LGBTQ+ or their families. And I have the best patient panel and the most fun providing healthcare that I ever could have imagined. And that it just seems like it is my delight to be able to be invited to that privileged space of helping people live into their authenticity.
Well, again, I can't imagine how inspiring it is to work with some of the folks that you do. But as you think about, kind of across the university and the people that have been involved in, supporting and helping to kind of make things happen, who are some of those folks that have been inspiring for you that are a part of the, University of Iowa healthcare, family, whether it's, faculty and staff or coworkers and residents? Can you talk a little bit about some of those folks that have inspired you as a part of that? Amy, you can go ahead.
Yeah, I'm gonna start here, and I'm pointing at Nicole Nisly over there, my girl. Because Nicole, I guess there's this magical thing that happens over coffee, because I think I first met the two of you, Katie and Nicole, at a coffee shop. And Nicole said, you know, Amy, why don't you come and see some of how I care for our patients in one of my evening clinics? And so I did. And I went to one evening clinic for about a 2-hour period of time. And Nicole brought me into each room and introduced me. And I just sat there. And I learned in that brief 2 hours how to truly communicate with patients. The subtle words that she was using that no one will ever teach you in a book or in medical school. You learn how to communicate by watching someone who's really good at it. What I've also learned from Nicole is while there's power in advocating for people who are very much like ourselves, there's just as equal, if not sometimes more power to advocate for people who are nothing like ourselves. And I see that in someone like Nicole, you know, all the time. And then I'll end by saying, you know, one comment that she mentioned about a year ago, and one of our colleagues was worried that she had made someone angry or mad or annoyed. And Nicole said, my middle name is annoying. And that's just how you have to sometimes get things done. And sometimes I think about that too. It's like, you know what, I'm going to be annoying today, but you know what, at the end of the day, things are going to happen. And Nicole is really the embodiment of that.
Katie, what about you? Who are the folks that inspire you?
Oh my goodness, Michelle, there are so many people that I think are on our team that have made this happen. And I'll just sort of mention one, knowing that I could have selected so many others, but one of them is a UI law professor that's really near and dear to my heart, Lynn Sandler, and Lynn was somebody else, Amy, that Nicole and I met at a coffee shop. I swear to you, we should be like thanking the Java House for all that they have done to really help this like come to fruition. But so Nicole is often the center of many of these connections, and I often tell people that when Nicole came up to me and said, Katie, I have to do a clinic in the evening, and my goodness, if I have to do a clinic in the evening, I want to take care of LGBTQ patients. Do you want to do that with me? And I said, of course. And also more of me thought that would never happen, but I just didn't know the like pure like force of nature that is Nicole Nisly. And so part of that is that she has the connection with many people, and she has this idea and thinks, and I may know someone who could help us. So we had coffee with Lynn Sandler, and this was early on where we pitched him this idea of maybe having a partnership with a college of law and how they could potentially help some of our LGBTQ patients, specifically our transgender patients, with things that are really important, that are sort of not really medical, but name change and gender marker change, and all of those things that help them navigate through the world safely. And Lynn thought about it, and in a very Lynn Sandler way, was sort of methodically not going to say yes, but think about it and get back to us. And he and his law students have put together this Iowa guide to changing your legal identity documents that has been downloaded, you know, tens of thousands of times in every state in the country and across other places, to use it as a model that is amazing. It has helped so many people be able to take on this very complicated process by just clicking the live and active links that are in this guide that we give to them a hard copy of, but that is also available on the web. So Lynn is just one of the many members that are even outside of sort of what you would traditionally think of as healthcare, which have helped to make this an amazing partnership that we really, and as a family doc, I love this, think about how do we take care of the whole person.
Well, I mean, I think that's terrific. We talk, you know, in the LGBTQ plus community, we talk about allies all the time in terms of kind of the support of our lives, but it's so incredibly important to have those allies throughout, you know, throughout the university system to be able to kind of make the vision of the clinic come true. So that's terrific. Nicole, what about you? Are there folks that you know inspire you throughout the process?
So I would say that how many hours would you have? Because I think, this is such an inspiring team, and each time that we encounter somebody and you help people see the community and fall in love with them, that person becomes a champion of their own and they create this whole universe, So for example, as you can see here, Dr. Pearlman created this entire universe, and that was inspired by her creativity and her love after she got to know the community, and it goes on and on. So I just received a text from my medical assistant, her name is Gabriela, which is the same name as my daughter. And she was just telling me about a patient that needed something or that she wanted to make something happen. I just spoke with my scheduler today, and their care every single moment. It doesn't matter if the patient is listening to you or not, to use the right pronoun, the right name. And, my nurse and our colleagues from the counseling program that make possible for people to receive counseling immediately and free of any cost. To my friends in the prison, in the Department of Corrections, that invited us to go in there and basically to help transform the Department of Corrections to allow people that are incarcerated to be able to use their preferred name and their preferred pronoun, and to allow them to receive the care they deserve, becoming one of the first in the country to do so. And I also just received a message from them saying, we have all these people that need care. So it goes on and on. You basically see, I think of it as that one pebble in the water, and then suddenly you see a wave and another wave, and all of us basically falling in love with the community, of the entire LGBTQ community. My friend Katie, of course, has been an incredible inspiration, seeing her story of discovering who she was and coming out and facing so many odds and creating a group in a medical school. In the interesting fate of things, I was actually working for the provost of the diversity officer, and she won an award. And I actually was the one to give her the award. Before I knew her, and she was hiking somewhere, so she never showed up for her award. But I was there back then. So the bottom line of the story is, it's really all of us together, right? Whether you identify as an LGBTQ identified person, a transgender person, or any of the identities, at the end of the story, it's humanity coming together to help each other. And as physicians, it's an immense privilege. Honestly, I think I should pay to do what I do as opposed to receiving my salary to do what I do, because it's just so amazingly inspiring every day. And today I will be in clinic until about 9 p.m. I have evening clinic, and at the end of the day, I feel just renewed. Today, I'm going to be seeing a patient that is very special to me. It was actually the first transgender patient that I took care of. And it so happens that she's my first patient in my clinic tonight. And she was the one that told me when I first met her, I've been in this healthcare system for about 20 years, and no one has ever examined me. And at the time, I didn't know what to say. I was speechless. And there was part of the story also that I felt unprepared to provide good care for her. And so it led to our journey of learning, all of us together. And so there you are, the story kind of goes back to a circle.
Oh, it's wonderful. And, you touched on the fact that you're, seeing a patient that was one of your first and stuff as you embarked on this journey. Nicole, can you talk a little bit more about what are the types of services and care that are offered through the clinic?
So our primary role is what we call primary care home. So I consider the primary care home really the home, right? So that's where you go for your care that includes hormone therapy, that includes, care for your cholesterol, for your blood pressure, your first pap smear, and particularly if you are a gender non-conforming person, that's such a special time, an important time, and also includes care coordination. So referring and preparing you for surgery, so I can hand you to someone like Dr. Pearlman so that she can help, create a beautiful vagina for a patient that needs one, and that help them become congruent with who they are, and people that might need a dermatological care and so on. So help them in their journey, right? So, but other things that we do include, for example, speech therapy. So one of the things that identify who you are is your voice. So if you're on the telephone and I cannot see you, that's the part of you that I see. And so voice is so important. Hormone therapy will not change your voice to a female voice. It will change your voice to a masculine voice. And so we're just launching our speech therapy program coming up in the next month or so. Other examples include if you are trying to, for example, dress and have hair. And what if you lost your hair already? And hair is such an important identity. If you're a woman, a trans woman, the same might feel like, now what I'm going to do if I lost my hair before I started my transition. So for example, thanks to the gifts that we received, including from you, we've been able to offer free wigs to our patients. They're actually offered by our beauty salon. So the wonderful ladies that give education on how you can do makeup and your nails and how we can take care of your hair. And sometimes people have no one to teach them how. And one of the patients that I'll actually be seeing today, about a month ago, received one of the wigs, and she came over to demonstrate how beautiful she feels and she looks, and she'll be coming over tonight with her brand new wig that she received from this program. So counseling, so our patients receive counseling and support for their transition. We have Katie help me, more things to talk about.
I think that you covered a lot of them, Nicole, but we have, many services and with each passing year, it becomes more and more comprehensive. Absolutely.
Then I'll just touch a little bit here because you mentioned the care coordination, which from a surgical standpoint is such a critical component. I think there are so many reconstructive surgeons like me who would love the opportunity to offer this surgery, but if you don't have the infrastructure in place and the nurses and the MAs to help coordinate that care between the different services, there's so much involved. There's probably 100 steps and 100 people that are required for a patient to get to the operating room. And each of those steps is so critical. And so if there's not someone whose job it is to take care of that step, someone like me cannot do surgery on our patients. And so that care coordination is such a critical piece and something that this clinic does extremely well and actually allows all of these services, to actually for us to all be able to take care of the patients.
Well, and I think that, as you all talk and you really talk about the holistic care that you provide, really looking at all elements of, what an individual needs to feel healthy and whole. I know for myself and for Anne, it was one of the things that we have just appreciated as we've heard the story and the mission and vision of what you all are working to do every day. So I think it's tremendous. When we think about the future of the clinic, Katie, can you talk a little bit about what are some of the challenges that that you face with the clinic, either through what it takes to be able to have new patients find out about the clinic and the awareness of it, to all those other elements. Can you talk about some of that?
Sure. Yeah. I think that we are all facing specific challenges with regards to the pandemic, for sure. And we know that our marginalized communities specifically will be affected disproportionately in many ways during the pandemic. And that's no different for the LGBTQ plus community. And one of the things that we've been able to really leverage during this time would be things like telemedicine. So when we have patients that have challenges with regards to their financial security, be it kind of finding transportation, that telemedicine has been super helpful. And while many of my colleagues use telemedicine during kind of the beginning stages of the pandemic back last year, that most of them have now gone back to almost 100% seeing their patients in person. And yet many of my patients continue to come see me via telemedicine because we do here at the LGBTQ clinic see patients from all across the state of Iowa and into sort of the surrounding states even. And so as opposed to them having to come and drive 4 to 5 hours to come see me, we can just do that visit in 15 minutes via telemedicine over synchronous audio visual connection through our patient portal. They can get their labs done at their own local lab. So I have all of the information that I really need and talk about what their next steps are. And it has been really amazing for this population in particular, I found, to be able to do these check-ins and not have to make this long trip. I would assume that Amy and Nicole have sort of similar situations where they've transitioned some of their practice to telemedicine, but it seems like this patient population in particular has really utilized that. So I just think that is one of the challenges that we will continue to see is just barriers to things like transportation, to some of the out-of-pocket costs that are associated with gender-affirming care. So we have some of it that is absolutely covered by insurance. We have some of it that if someone is under or uninsured, that those costs for medications may not be covered. And then we have a lot that even with the best insurance, it is very rarely covered. So things like laser hair removal, things like any sort of like hair transplant, a lot of times breast augmentation, these procedures, which are very medically necessary and gender affirming, they are hardly ever covered by even the best insurance plan. And so that will always be a challenge for this patient population. And we're always looking for ways to be able to help them receive these medically necessary services that they need.
Well, I mean, I think that's I think it's a great way to kind of think about, there's a lot that goes into this. So just like we talked about the allyship, there's a lot that you all need to be able to make this happen every day and to, deliver the quality of care. So, what can we do as, as the audience and stuff that's here today, as the general public, the public at large, to help support the mission that you all have in serving the LGBTQ plus community? So what can we do? How can we help?
So I can start by tackling this one. It's all of our responsibility. I think the people who are joining this call have a particular interest in understanding how those of you who are joining can help. But whenever I have any trainees who come through my clinic, everyone sees my transgender patients because everyone has to know how to take care of them. And even though only the minority will ever do surgery on those patients, you got to know how to talk to our patients in a way that's respectful. And when I teach my urology trainees how to do the surgery, I also understand that the minority of them will be doing the surgeries, but you understand so much more of anatomy by when you take something apart and then you put it back together. And so in all of these opportunities, in all of these clinics, there's this incredible way of learning how to communicate and offer services, to a variety of different patients. And what's been great at Iowa over the last year is all these different sections of the hospital have said, hey, Dr. Pearlman, we hear that you're offering this type of surgery. Would you mind educating our staff? So I've worked with students and residents to go to the pre-op staff and the post-op staff and the hospital inpatient, nursing units. And I haven't had to beg anybody for those things. They all say, you know what, this is really important. We want to do better and we want to learn. And that is such a beautiful thing at Iowa. And that's really all of our responsibilities, because all of these patients who are seen through this specific clinic, they all have hearts, they all have lungs, they all have bowels. So they're going to be seen in every single clinic in the hospital of the university, at the University of Iowa, but anywhere where any of our trainees practice.
So I'd like to say that, again, many people have been so incredibly generous to donate to the fund, and some of the examples of where we use the fund. So for example, Dr. Pearlman might do surgery on someone who will need a dilator, and some people can't afford a dilator, others cannot at all, because some of our patients are underemployed. It may be hard for them to find employment due to their identity, for example. And so we've been able to offer some of these, that wig, that beautiful wig that our patient is going to show me tonight that she was so proud of came from that. Some books. We have books that we give to some of our young people that it's a workbook for you to work through who you are, your identity. You know, you're questioning, who am I? Where do I belong in the LGBTQ identity? And those are things that we have been able to use some of the funds for, among many others, the voice therapy workbooks and many others that we hope to begin. I am envisioning and sort of dying to see a queer choir to help so many voices, you know, as people practice their voice, but also all the identities together. Once the pandemic ends, and I know it will end, we were already in the process of working to create support groups. So many of my patients tell me every day, I'm the only one in my town. I don't know anybody else. I'm afraid of going to a group and seeing something a little weird in there. And so how do I meet people? And I was envisioning, what if we had get-togethers to talk about surgery, or to talk about voice, or to talk about makeup, or even to talk about cholesterol, whatever it is, and brought the community together. We see over 1,000 patients, so people will meet each other. The community will meet each other in a way that it's in their own terms. So those are things that we were in the process of organizing when suddenly we couldn't get together anymore, but we will. And I feel like if we have some of those resources, we can put together to help the community in so many different ways. As
Katie, other thoughts that you have about, you know, what you need from others to be able to bring the mission to life?
Yeah, thanks, Michelle. You know, I think that I would echo a lot of what Nicole talked about, and just things that we have absolutely been able to use those funds for. I give that Gender Quest workbook to almost every one of my patients who's kind of in that adolescent, young adult age. It is wonderful and great, and I encourage them to really go through it kind of page by page with themselves or with their therapist. It is so integral to, I think, being able to really lean into your gender identity. But I also want to really think big and think about what we could do if we had a collection of large enough donations where we could actually fund salary or fund a position. And like Amy was talking about, I think that care coordinator role is somebody who could really be looked at as to walking a transgender patient through the entire process, whether it's making sure that every interaction that they have in our hospital system, that there's a phone call ahead of time saying, just to let you know, on your cardiology schedule is a transgender patient, these are their pronouns, these are their names, and we have all of that stuff. But it would just be really a concierge for our trans patients, because we know because we have national data that transgender patients have experienced discrimination in healthcare. So they, whether or not they know someone who for sure has, and they've delayed healthcare because of it. And so being able to really kind of make up for those mistakes and regain the trust from this community, we could do something like having a care coordinator who helps navigate step by step for us, and helps, you know, make sure that we can streamline all of the things having to do with every aspect of their care, whether it's gender affirming care or whether it's just having to go through other parts of the hospital to deal with any sort of chronic illness that they might have.
And then the last thing that I was just going to touch on here to address one of the great questions from an audience member is, you know, I think funding would allow the clinic, and a lot of us on this call are from different areas and just sort of, you know, happen to end up at the University of Iowa. But additional funding, I think, would allow this national, international search to bring in specialists from all over the world who could represent so many of the people that we're taking care of. And I think that's what that funding could do. So it's not only a center that's well known within Iowa, but like worldwide, this is the place to go. This is where other centers come to learn how to do it. And I think that that's what that funding could help with too.
Well, I love the idea of thinking big, right? Associated with all of those things to continue to raise the awareness, and awareness happens in a variety of ways. It happens through activities like this. I know Amy has placed some things in the chat and stuff as well as it relates to a YouTube channel that is being leveraged and things as well to help raise awareness. So there's really great creative ways that those things are happening to continue to drive awareness for the care that's available. I think one of the things that I'd like to do now, Tony, if you're ready, I think it's a great time to open up some Q&A while we've got a few minutes here. And have you facilitate that process.
Excellent. Well, thank you very much, Michelle, and thank you to the providers. This has been just lovely and very educational and informative. We really appreciate you being on our show today. We have time for a few questions from the audience, and so we'll just start out with, if someone wanted to follow in your footsteps and get into this career, what advice would you have for them? Dr. Nisly?
Sure. So, as Dr. Pearlman mentioned, and Dr. Imborek as well, every day we take trainees with us, every single day. And I think every moment is an opportunity. My trainee could be a medical student, could be a pharmacy student, and I'll have both tonight, for example, could be a resident, but it could also be a medical assistant. It could be somebody in nursing training. I just trained someone who is in the Quad Cities at the project, which offers HIV care in people with hepatitis C. And they have a nurse practitioner that would like to provide hormone care there. And so she's spending some time with me learning. So our goal is not to just create a plan, the University of Iowa, a wonderful center, which is what we want to do, but we want to also multiply this knowledge, right? So we want every place to have access. And as Dr. Pearlman mentioned here, our goal is to educate. So I would say that every moment is an opportunity to train everybody. And so I would like to see a world where, hopefully a clinic like this may not be necessary because it is part of everyday care. And there is not a health provider that has not received the training they need to provide welcoming and inclusive care.
Excellent.
So, and then I'll go next here. Oh,
go ahead.
I'll hop in real quick here. I would say so much of what I do now as a surgeon, I never saw and I never read in a textbook and I never learned how to do despite like 15 years of training. And so when we found that this need to do the gender affirming bottom surgery, was a need at Iowa, my colleague and I, Dr. Erickson, we spoke and we said, where can we learn how to do this? And we reached out to a surgeon in Oregon who said, come on over, I'll teach you. We were there for a couple of days. We learned how to do the surgery. And it was recognizing that those many years that we spent in the operating room was learning the basic surgical skills. But then it's, just in our careers, that's where we actually learn what skills that we need to do to actually do our jobs and to provide new services. And that's what I would encourage everyone on this call, people in healthcare, is the goals of going to school is to learn ways of thinking and to ask the good questions and to say, I wonder how I can make this happen. And then real life after training is to figure out, well, who can I go to learn these additional skills? And at some point you just develop the gusto and the knowledge to say, now I'm going to do it. And it's just really finding those resources and then just doing it at some point.
Very cool. Dr. Imborek, anything else to add?
I don't think so, Tony. I think that they covered it for sure.
Well, we appreciate how driven you all are, and we also have got some questions about, what can we do to be allies, and I think you just answered that, is to educate ourselves. Couple more questions here. Resources for parents. What do you offer there?
So, Tony, if I may, the University of Iowa president, Harold, the previous president, he and his wife are married. They're parents of a trans woman, and I heard their stories. I got to meet their daughter, and I asked them, they told me their story. So I asked them to record a video, and you'll be on our website, the LGBTQ clinic website. And they talk about, as parents of a trans daughter, how do they react? So for example, Mary, mom, she felt that, that's the right journey. She was immediately supportive, President Harold says that he was confused. He was scared. He was worried. So such typical reactions, right? So we have one parent and another reacting differently. At the end, they realized that there was their mission, and that's their daughter is you know, their child and will always be their child, and whether before they had a son and now they have a daughter. So they told their story. So that's one example that I felt like they left this for us. And I asked them to do it because I felt that it's such an example of, you know, parents also go through a transition, right? So you had a baby that used to be a boy and now it's a girl, and vice versa. And now I think learning the experience of the parents, the partners, you know, you married someone who was a woman and now it's a man, or vice versa, or someone who is a non-binary person. So the family members also experience a transition. And I think there are resources there, including our counseling program, the University of Iowa Family Counseling, that provides family counseling for the partner, the child, the spouse, the parent, the, you know, the family that is transitioning with our patient as well.
Well, it's a really unique perspective. I think probably a lot of us had not realized that that family is going through that transition as well. Dr. Pearlman, anything to add?
It's a remarkable thing when parents and spouses come in with the person who's coming to see me to talk about surgery. You know, when I see them beforehand, when I visit them in the hospital and their parents are sitting by the bedside and I say, you know, who are these two lovely people with you today? And they say, oh, that's my mom and dad. And I don't worry as much about those patients because they have that support system. And even though it's been difficult learning the surgery and refining my surgical skills, I think one of the toughest challenges is making sure that my patients have the support system so that once I do the surgery, that I'm setting them up for success, that they're going to do well afterwards. And a lot of that is out of my control. And that's where, you know, the counseling service can be incredibly helpful. That's where the primary care folks can be incredibly helpful. But I don't worry about my patients who have that incredible support system. It is perhaps the most important thing.
Yeah, I think that we all agree that this, you know, support system is key to this. And we've got time for just a couple more questions here, maybe even one. I'll start with you, Dr. Imborek. What is the future of the clinic? We know that it's a flagship clinic. We know that people from all over the country are coming to you to learn how to do it. You know, what's sort of the next steps?
Yeah, thanks, Tony. I think that when we're looking toward what we could improve upon or what we could expand to, we have expanded our primary care footprint, and where it was just Nicole and I to start, we've added on one additional family medicine physician, and Nicole has a physician assistant from internal medicine. We have an OBGYN who does surgery as well as primary care. But it's really looking towards some of those surgical subspecialties. So we have Dr. Pearlman and Dr. Erickson from urology that are doing vaginoplasty or the creation of a new vagina and trans feminine patients. But there are other surgeries that we really haven't expanded to that I think are on the horizon, and I know that we're going to get there. And those would be things like phalloplasties or the creation of a penis for transmasculine people. I feel like we're really close to be able to doing comprehensive facial feminization surgery for trans feminine persons. So it's really looking at some of these more complex gender-affirming surgical procedures that I think are sort of on the horizon, and that we have the clinical expertise to do. We just need to sort of keep pushing forward and see it all the way through.
The other thing that we had touched on, and we've had some meetings about this, is just creating a research infrastructure. You know, the other great thing about the clinic is versus other places where they offer this surgery, and then let's say it's in California or New York, you know, a lot of those patients are coming from around the world for their surgeries, and then they're going back to wherever they live in another part of the world. And for a lot of the patients that we operate on, these are our local patients. So we have this unique ability to follow them long term. It's some of the work that we're doing. You know, what are the quality of life measures 3 months after surgery and a year after surgery? And I need to know that as a surgeon, not to feed my ego. But if there are things that I'm not doing well, I need to know that information so I can do better. And so it's this unique opportunity to build these databases so that we can change the way that research is done, so we can change the lab values. How do those lab value reference ranges need to be changed to best care for our transgender patients? So I think there's a big opportunity to create research studies that will actually improve patient care as well, and clinical algorithms.
So one of the things that we hear so much about are health inequalities, meaning that, you know, people come to the hospital and not all come out the same, right? Some people do great. Other people face barriers, and the trans community has been one that has faced so many barriers. And we're seeing over the last 10 years that that has changed, effectively changed. So we have talked for so long about health inequalities, and we're seeing that actually this is equalizing for this community. They are getting the care they need and deserve. So to me, that's also a learning experience. Can we do that for other communities? They're not receiving the same care. Can we learn from what we learned on this experience and say, you know, can that happen to other communities that can also be fantastic and transformative as well? That's the other thing that I envision that I'd like to see happen.
That's great. So it sounds to me like we need funding, we need to further educate ourselves, we need research, and we need to just figure out the best way to help people. And we've got 4 really with Michelle, wonderful people that are doing just that. So I do want to wrap up here. I'd like to read something that was posted in the chat, just a comment from a patient of Dr. Nisly. And she wants to affirm that she is the most caring healthcare provider she's ever experienced. The clinic offers a safe, welcoming environment for all aspects of my well-being. So congratulations to you. Thank you all for joining us today. I've gotten some requests for having these links put out in an email, which we will do. We will also eventually have this recorded to our YouTube page and send that out for anyone that wants to watch it again, or for anyone that might have missed it. Tap from the Cap is the ongoing series, and our next one is in September 8th, and we are going to be featuring a gentleman that will tell us everything we need to know about Bitcoin. So Chat from the Old Cap, very diverse audience, very diverse topics, very diverse guests, as you might imagine. But I can't thank Dr. Imborek, Dr. Pearlman, Dr. Nisly, and Michelle Bates for being on our show today. Also Meg Reif from the University of Iowa Center for Advancement for doing our introductions. Thank you all very much for your time today. On Iowa, and go Hawks.
Thank you.